Hello. It's just gone midnight. Well, when I'm recording this, it's just gone midnight. Probably not midnight where you are. I am in a hospital. So you remember me saying a few days ago about some surgery. Oh, that has been today. You have to excuse my voice, by the way. It's very, very croaky. But yeah, I've been here since 7 o'clock this morning. I was admitted at about 7 o'clock, got into my room here about 10 past 7. I was all kitted up for surgery by about 8 o'clock, and then I was in theatre for about 10 past 8 this morning, all very quick. And it's to have the kidney stone removed again. The reason this has been quite urgent is because it's thought that it's the same kidney stone that hadn't been removed the first time round. You remember the one that was all in my head for 4 months, and then they removed it, but they didn't remove it, and then the pain was still there, but it was only there because it was all in my head because it had been removed even though it hadn't been removed. That one, that's the one. So that's the one that I can tell you, has been removed today. Thank you. I don't know if it's been removed in one big chunk or in several chunks because I haven't spoken to the surgeon yet, but apparently it's been sent off for a biopsy, which panicked me because when you hear the word biopsy, you think cancer, don't you? But apparently not cancer. It's just to find out, I'm sorry, I'm moving my hand. It's just to find out what it's made of, because kidney stones can be made of different things, so that they can find out how it's formed and what I can do to avoid it in future, or find out how it formed. So the surgery apparently was a bit more challenging and difficult than they were first expecting. I was in there a little bit longer than planned, and all sorts of devices and rods and things were used to get it out. But it's out, which is the main thing, which I'm thankful for. So I came into recovery about 10:30 and had a bit of a fit as I was coming round. I was just shaking, uncontrollably shaking and not making much sense. I do remember it, even though I was kind of coming round, and some people who have fits don't remember it. I do remember it. And it took about half an hour. My blood pressure dropped really low, my heart rate dropped really low, and it took some time to get them back up to normal. And then I was brought back here, chocolates, water, and this is where I've been all day. So the good thing is that I don't have the kidney stone anymore, which is brilliant. The other good thing is I don't have the pain that I had after the first kidney stone operation, because when I woke up from that, I was in absolute agony, like 10 out of 10. It was worse than the kidney stone itself. It felt like my bladder was full of broken glass and somebody was standing on it. And I haven't had that this time, which is another good sign. And I do have a stent in. The stent is only temporary, and I have to take that out in a few days. I have to take that out in a few days. So I have to go home, and the stent, if you don't already know, is like a soft rubber tube, and it runs from the kidney down the ureter into the bladder. So the liquid goes down there and it doesn't run through the inflamed ureter where he's been pushing the tube to get the stone out. Now from the bladder, there's a piece of cotton attached to it, and the cotton runs through my bladder, through my willy, and then out of the end of the willy. And then there's about 8 inches of cotton looped round. Why I have to tell you there's 8 inches, well, you already know now. Because obviously when guys are asleep, things happen, and the cotton doesn't want to be disappearing inside my willy, and they have to put another rod in to retrieve it. So basically they put enough excess and then tape that around my willy. And then in a few days, I have to get hold of that, and I literally, physically have to pull the stent out myself. Now, I did have that done the first time, and it wasn't actually that bad. It sounds a lot worse than it is. The kind of nippiness of having the cotton running through your willy and then out of the end, so every time you move, feels like it's cutting the end. It isn't, because it's quite soft cotton, but it just feels very nippy. So yeah, it'd be nice when that comes out, and I can feel the stent, but I can't feel it as much as I felt the original one 2 years ago, which is again is a good sign. So today, just been recovering, really, not much pain. I would say it's only maybe a 3 or a 4 out of 10, whereas the last time it was like a 10. So I've been drinking lots of water. You can see there the little blue jug. I've probably been going through about one of those every couple of hours. I'm going for a wee every half hour, which is running quite clear. Too much information, but there you go. It's a good sign, apparently. And I've been eating plenty as well. Nice food. I had a fish finger sandwich and then a chocolate brownie with vanilla ice cream. And the ice cream was lovely for my throat, because I don't know what they did when they were putting me under, but he must have been ramming that thing down my throat. Not something that I usually complain about, to be honest. But I've got kind of all cuts around inside my mouth. But it's to be expected, isn't it? That'll go in a few days. It should do anyway. And that's it, really. Sean's been here since about 3 o'clock. He joined me for dinner. He had a pie. Hospital food here is actually quite nice. And he's gone back. He's staying in a hotel in Edinburgh. And then he's going to come back in the morning, and hopefully, if everything's as it should be, which it sounds like it is, all my stats are all right, and my pain levels are where they should be. The only couple of things that are not worrying me, but I get ectopic beats called PVC heartbeats, and it's like every now and then your heart will miss a beat, and then it will do another beat to catch it up, and that beat to catch it up is quite a kick. So when you're laid in bed, you kind of notice it more. And I think, I get those anyway. I get probably 1 to 3% of my total beats of those. And today it's been a bit more, but I think it's just because I'm trauma of surgery, and because I'm laid here thinking about it. So that's probably all it is. So the staff are not too worried about it. Everything else is good. Heart rate is back up to about 60 beats a minute. Blood pressure is spot on. Blood oxygen's quite good, so everything's all right. My pain's all right. I'm only taking ibuprofen and paracetamol. But the main thing is that the stone's out, because it's now been in there at least 2.5 to 3 years, and the risk if we would have left it would be that where it was in the kidney, it was starting to stop urine from coming out, and it would have kept swelling, and it would have caused damage to the kidney. I could have got a kidney disease. I could have lost function of that kidney. That's what they've been frightened about, and that's why they've needed to get the surgery done quite urgently. But it's done. It's done. It's out. Fingers crossed. That's this chapter. It's now sorted. It's not the end of the story. I've got a couple of other issues which I'll tell you about soon. One which could be quite life-changing. The other I'm hoping is not going to be too bad. But just mistakes. The other things that I've got to now see to are things that could have been seen to a year ago, 2 years ago. And I have been getting a lot of comments from people saying, oh, you need to sue them, you need to change your GP, you need to take action. And the first thing I've got to do is get me right. And once I'm fit to take the fight on, then there is a fight coming, because the kidney stone is not, it's not the end, it's not the beginning of it. There are some serious things that have been going on that have been missed, mistakes have been made, and well, some bad things have happened, which I'll tell you about soon, but things are not good. As for me, nothing seems to be life-threatening, touch wood. The other couple of things, hopefully, are treatable. They are life-changing in the way that I'm going to be able to live my life, and the things I'm going to be able to do is going to change all that, but hopefully, touch wood, fingers crossed, not life-threatening. But now, for now, I've got to try and get some rest. It's well past midnight. I've not had any sleep last night, not had any sleep today. I really need to try and get some rest, but I'm just not tired at all, so I'll probably just lay here and play on my phone, get up for a wee every half an hour, and then probably sleep more tomorrow once I get home. Obviously, this is uncomfortable with a piece of cotton coming out the end of it. I've got to be careful what I do, but it's not too bad. There you go. I've rattled on enough. 10 minutes. It's not bad for a 2-minute update, is it? So I'm going to go get some rest. I'm going to go have a wee, but you're not following me there. And I will check in with you next time. Take care of yourself. Thank you all for your concern. It does mean a lot, and all the messages and all the support. Thank you. I've been reading them all today. It does mean a lot, more than you'd know. Take care of yourself. See you later. Bye.